Hi friends, we will discuss about basics of ECG. Even though it is a big subject, we will try to study it from the viewpoint of a nurse. First of all, electrocardiography, that is also called as ECG, is a fundamental part of cardiovascular assessment. It is an essential tool for investigating cardiac arrhythmias, that is abnormal rhythms, and is also useful in diagnosing cardiac disorders such as myocardial infarction, heart blocks, cardiac hypertrophies, and many more. Mainly there are two major activities happening in the heart. Number 1, electrical activity, and number 2, mechanical activity. ECG is used to analyze the electrical activity of the heart, and echocardiography is used to evaluate the mechanical activity of the heart. Before we move to details, let us learn few fundamental concepts. What is the difference between the electrocardiograph and electrocardiogram? Electrocardiograph is a machine used to identify the electrical activity of the heart by identifying and analyzing the electrical signals by placing different leads on the skin surface of a patient. On the other hand, the term electrocardiogram means the graphical representation of the electrical activity of the heart. It is also called as rhythm strip or ECG strip. Even though there are only 10 electrodes in an ECG machine, we get 12 different leads. It is achieved through the comparison of different leads. Before we start to discuss about ECG, let us learn about conduction system of heart. To pump blood throughout the body, the muscles of the heart must be coordinated perfectly by squeezing the blood in the right direction, at the right time, and at the right pressure. This is achieved by conduction system of heart. Sinoatrial node. It is also called as SA node. It is the natural pacemaker of heart. It is positioned at the top of the right. Electrical impulse begins at the sinoatrial node and passes through the right and left atrium. It causes the atria to contract and push blood down into the ventricles. Electrical impulse travels to atrioventricular node, also known as AV node. This acts as a gate, which causes slight delay in transfer of impulses, so that the atria and ventricles do not contract at the same time. From here, the impulses move down through bundle of His and Purkinje fibers, causing the ventricles to contract. Let us discuss about how to take an ECG. First of all, try to make the patient calm and quiet before taking an ECG. Because heart rates are also calculated and evaluated with the help of an ECG, provide privacy, provide supine position, and expose chest and limbs to attach electrodes. Clean the area before attaching electrodes. Apply jelly to facilitate good conduction between skin and electrodes. Attach limb leads as directed by the manufacturer. Chest lead positions. It is very important to place leads on its correct position. Wrong lead placements can result in wrong interpretation of ECG. V1 and V2 should be placed on 4th intercostal space, right and left sternal border. V4 on 5th intercostal space, left midclavicular line. V3 on 5th intercostal space, halfway between V2 and V4. V5 on 5th intercostal space, left anterior axillary line. V6 on 5th intercostal space, left mid-axillary line. A standard ECG machine print an ECG stripe at a speed of 25 mm per second. Now we will study more details about an ECG graph paper. ECG graph paper is divided into large squares by bold lines, and each large square is further divided into 5 small squares. Each small square is 1 mm wide and each large square is 5 mm wide. Each 1 mm small square is equivalent to 0.04 seconds, and each 5 mm large square is equivalent to 0.20 seconds. The electrical activity detected by the ECG machine is measured in millivolts. Time duration is measured on horizontal line, and amplitude or voltage is measured on vertical line. We will discuss about the waveforms in normal ECG. These are the waveforms found in an ECG during a normal cardiac cycle. Here we can find 3 different patterns. They are, number 1, an isoelectric line, which is straight in shape, number 2, positive deflection, that are above isoelectric line, and number 3, negative deflection, that are below isoelectric line. Names given to these waveform based on their origin are P, Q, R, S, and T. When electrical impulse travels from SA node, waveforms are produced. When there is no electrical activity in heart, for example, during cardiac arrest or death, the waveform we get is isoelectric line, also called flat line. Before starting with different waves, let me explain about two terms, that are depolarization and repolarization. Contraction of cardiac muscle is called depolarization and relaxation of cardiac muscle is called repolarization. First wave produced in a normal cardiac cycle is P wave. It is an upward deflection. P wave is produced when the depolarization of right and left atrium is happening. In other words, when the electrical impulses pass through the atrium, it contracts. Normal maximum length of a P wave is 0.10 seconds. In other words, the maximum length of a normal P wave is 2½ small squares. After P wave, we get PR interval. It is an isoelectric line. During this time, electrical impulses are paused in a V node. It prevents the contraction atrium and ventricles at the same time. It also facilitates the movement of blood from atrium to ventricles through atrioventricular valves. In a normal ECG, the maximum length of PR interval is 0.12 seconds to 0.20 seconds. 3 to 5 small squares. After a short pause, electrical impulses move through bundle of His and Purkinje fibers, which results in depolarization of the ventricles. During this time we get QRS complex. By this time, blood is pumped out of the heart, through aorta and pulmonary artery. The normal length of QRS complex is less than 0.12 seconds, that is less than 3 small squares. The last waveforms we get in a normal ECG is T wave. We get T wave when the heart is in resting phase. We will discuss about the characteristics of normal sinus rhythm. In order to understand the abnormalities in an ECG, first we have to understand its normal characteristics. I will explain 7 basic features of a normal sinus rhythm. They are rate, regularity, P waves, PR interval, QRS duration, ST segment, and T waves. First characteristics of normal sinus rhythm is rate. Let me ask one question. Is it possible to calculate heart rate using an ECG? Yes, it is possible. First method is rule of 300. Count the number of big boxes between two neighboring R waves, and divide this number with 300. We will get an approximate number of heart rate. Although it is a fast method to calculate heart rate, this can be used only if the rhythm is regular. Let us examine this ECG. Count the big boxes between two R waves. There are 6 big boxes between two R waves. We have to divide 300 with 6. Heart rate is 50. What is this 300? And how we got this number? Let us analyze it. We learned that ECG is printed at a speed of 25 mm per second. 25 mm is same as 25 small squares. 25 small squares is same as 5 big squares. When we multiply the total number of big boxes printed in a single second with 60, that is, 60 seconds in 1 minute, we get 300. If the heart rate is within the range of 60 and 100, we can call it as normal in rate. Second method is rule of 10 second. When the heart rate is irregular, take the ECG and count the entire R waves on it. Let us examine this ECG. Count all R waves in this ECG. Here we have 33 R waves. As per rule of 10 to multiply the total number of R waves with 6. Here the answer is 198. What is this 6? And how we got this number? An entire ECG is printed in 10 seconds. If we can identify the heart rate of 10 seconds, we have to multiply it with 6 to get the heart rate of 1 minute. Second characteristics of a normal sinus rhythm is regularity. Look at the RR distances in this ECG. Are they equal in distance? Or irregular? In a normal ECG, the R waves are in equal intervals. Third characteristics of a normal sinus rhythm is presence of P waves before each QRS complex. Let us examine this ECG and ask few questions to ourselves. Is there one P wave before each QRS complex? Yes, we have. Do the P waves all look alike? Yes, similar in shape. Do the P waves occur at a regular rate? And the length is 0.10 or less? Yes, it is. If all these criteria are fulfilled, we can say that it a normal P wave. Fourth characteristics of a normal sinus rhythm is duration of PR interval. In a normal ECG, the maximum length of PR interval is 0.12 seconds to 0.20 seconds. That means 3 to 5 small squares. Let us analyze this ECG. Here the PR interval is within 3 to 5 boxes. So we can say that it is a normal PR interval. Fifth characteristics of a normal sinus rhythm is QRS duration. Normal length of QRS complex is less than 0.12 seconds, that is less than 3 small squares. Let us analyze this ECG. Here the QRS duration is within 3 small boxes. So we can say that it is a normal QRS complex. Sixth characteristics of a normal sinus rhythm is normal ST segment and normal T wave. Let us examine this ECG. Here the ST segment is not elevated or depressed. So we can say that it is normal. T waves are also normal, because it is not toll or inverted.